So, today we're talking about something super important but often misunderstood: diabetes in older adults. Yeah, it's a serious health condition. But guess what? You totally can prevent it or even manage it better with a few simple steps. Okay, so first off, what even is diabetes? It's when your blood sugar, which is basically your glucose, gets way too high. Normally, insulin helps move that sugar into your cells so you can use it for energy. But with diabetes, your body either isn't making enough insulin, isn't using it properly, or sometimes both. So, this leaves too much sugar floating around in your blood, and that can cause some pretty serious long-term side effects. Now, I just want to say, this video is for informational purposes only. Always talk to your doctor before making changes to your health routine, okay? So, how do people even get diabetes? Well, type 1 is usually diagnosed when you're young. Your body just doesn't make enough insulin from the get-go. But most older adults deal with type 2, which is when your cells kind of stop responding to insulin properly. Risk factors? If you're overweight, not very active, had gestational diabetes, or if it runs in your family, your chances go up. And certain groups like Hispanic, African American, Asian American, and Native American folks are at higher risk too. Now, let's talk symptoms. You know, those signs you shouldn't ignore. Feeling super tired or hungry constantly, thirst that won't quit. Frequent bathroom trips, tingling or numbness in your hands or feet, blurred vision, or cuts that just won't heal. Don't think it's just aging. Seriously, get checked if you notice these. Why? Because if untreated, diabetes can mess up your eyes, kidneys, heart, nerves, the whole lot. And it raises your chances for dementia, depression, infections, even some types of cancer. So early detection? Yeah, it's a game changer. But here's the good part. You can lower your risk, like way down. Here's how: move your body. Walking most days is amazing for lowering blood sugar. Eat balanced, healthy meals. Ditch processed foods. Go for whole grains, veggies, and lean proteins. Keep a healthy weight. Every pound counts. Regular checkups, especially if you're over 45 or have risk factors. And if you've already got type 2, don't worry, you've got this. Keep track of your blood sugar levels. Know your A1C. Stick to your meds, even if you feel totally fine. Maintain a good diet and stay active. Watch your blood pressure and cholesterol. Don't skip eye, kidney, or foot exams. And seriously, quit smoking if you do. All these steps can help you avoid or delay serious complications and keep you feeling your best longer. Remember, diabetes doesn't have to run your life. With a few changes, you can control it and live healthily. But always check with your doctor first before making any big moves. If you found this helpful, go ahead. Hit that like button, subscribe, and turn on those notifications so you don't miss anything. Oh, and if you want to stay even more in the know, check out our newsletter at www.agelesshealthandwellbeing.com. Links in the description. Take care of yourself, guys.